I'm Aundrea Cline-Thomas with ISPOR TV. Health technology assessments cannot happen in a silo, which is why we're so excited to have all of the stakeholders in conversation who are leading the way, starting with Nicholas Hedberg. Thank you so much for being here. So our question is, HTA regulation places a strong emphasis on developing medicines that address unmet medical needs. The question is, what are some of the key considerations for defining those unmet needs?
Thank you for inviting me, and thank you for the question. It's a very good one and also a difficult one, since unmet need is not only important in the HTA regulation, but also very much discussed and very important in the new proposal for a new pharma legislation in Europe, in EU. So I think the exact and agreed consolidated definition might still be out there to be, but it has to do with the severity of disease. How will this disease affect your predicted lifespan, your quality of life during the lifespan you have left? But also, I think people tend to pay attention to which are the alternative treatments available. Are there none, or are there some? And what is the expected effectiveness of the treatment coming into therapy? So those are a few of the ingredients, but the exact definition is actually something we're still waiting for.
And not having that definition, what challenges does that create?
I think there are ways to work around that, because the decision making, for example, in HTA and in pricing reimbursement, will be on national level. So there will also come in national factors to this. But I think we have right now what we need to do a proper work, and especially to put down the scientific assessment that we are set out to do, and evaluating the evidence for a certain product.
Are there any external or societal factors that need to be considered when kind of creating that definition?
Absolutely. But the HTA regulation focuses on the four dimension, that is the disease, the treatment, the safety, and the effectiveness. So I guess a lot of those factors will, as I said, come in the later phases and also in the national processes.
And what excites you kind of about what you're working on right now, about what the future holds?
Right now, we are 55 days from the launch of the new regulation. So that's really, of course, that's the core of the excitement. Perhaps, I mean, that's a Sunday even, so perhaps not so much will happen that day, but that is when we go live, and it's going to be tremendously interesting to see how we develop in the beginning of this new process, because it's a game changer.
Thank you so much. And Anna Willemsen continues the conversation. So while there's been a great deal of discussion about the areas that will be addressed by the new EU HTA regulation, what are the topics or areas that it will not address?
That's a very relevant question, and I often do hear that there's a bit of confusion there. So I do think it starts with a difference between what regulators do and what we on the HTA side do. Now I'm focusing on Europe. So when I look at the European Medicines Agency, and then specifically for pharmaceuticals, they look at the benefit-risk ratio, amongst other things. But it's just looking at the technology that comes to the market. When we look at HTA, we are comparative by nature. So we are comparing the new technology to some things or multiple things that are already existing and already on the market. Now that the HTA regulation comes into place, we split HTA up in European HTA and then still national HTA. So on the European level, we focus only on the clinical domains. And that means there will be no value judgments and no conclusions on added value or reimbursement. That has to be done on the national level. And that means on the national level, they may add cost effectiveness information, ethical considerations, or any other aspects that are relevant to start really weighing the arguments on effectiveness and safety to make those reimbursement decisions.
And so not having that regulation address that, what are the challenges it presents for healthcare systems?
So I think that means that there is still work to be done after we have done a joint clinical assessment on the European level. So healthcare systems need to understand when they can start nationally with those assessments while still being timely, but not duplicating, the information that has been done on the European level. What I think at the moment is one of the challenges is that industry might not be submitting at the same time or at all to market their new technologies. I think that that's quite a big problem, and I hope also with the regulation that will be addressed, because we have this early clinical overview. Basically, we have a first assessment there that can be used, so hopefully it can all come quicker to the market.
Fantastic. Thank you so much for your insight. We really appreciate it.
You're welcome.
Now for a look at the impact on the Central and Eastern European region, we're joined now by Zoltan Kalo. Thank you for being here. Now, why is the successful implementation of the new EU HTA regulation so critical to the Central and Eastern European region?
So the Central and Eastern European region are traditionally not as wealthy as the Western European region. We've got limited capacities for implementing health technology assessment. Our healthcare systems are not as advanced as Western European countries. If we can benefit from the reduced duplication of effort so that we don't need to do in parallel many things in Europe, I think these countries can focus on what is really important for them. So the joint clinical assessment will be fantastic for these countries because they don't need to do it again. They can benefit from a joint European effort, and they can really concentrate on doing cost effectiveness analysis, budget impact analysis, which unfortunately for poorer countries is far more important than for very rich countries.
So does this expand access then?
Definitely. If we can have better negotiation power for our healthcare payers based on health technology assessment conclusions, I really hope that we can expand access of health technologies to patients. Our patients have more limited access to health technologies than more affluent countries. We need really more solutions maybe than even Western European countries. So actually having a European movement towards this direction is utmost important for our countries.
Let's bring it down to the ground. So what does this mean for patient health outcomes?
If we look at new medicines, unfortunately, our countries cannot pay as much for a medicine as a rich country can pay. And that's the reason why we have to empower our healthcare payers to negotiate about drug prices. And if we can have lower drug prices in our systems, we can increase patient access. And health technology assessment is a tool to calculate the value of new health technologies. And if we are able to do it with more efficiency, ultimately we can expand access to technologies, and our patients will be better off by living longer, having better quality of life, which is obviously as important for our region as for other countries.
Fantastic. Thank you so much for your time and your insight.
You are very welcome.
Next, we asked Oriol Sola-Morales how HTA regulation would advance innovation in the national healthcare system. Do you think the EU Health Technology Assessments Regulation would advance innovation in the national healthcare systems?
Well, the EU HTA regulation is certainly a huge opportunity. It's a good opportunity. It's not going to be easy, and I'll go into that. But it is not only an opportunity, but it's a law. And like most of the laws, or like all the laws, we have to apply them. Why do I think it's a good opportunity? I think it's a good opportunity because it gives a very strong signal to health technology developers on what the legislator, what the society is looking for. And at the end of the day, one of the issues with technology development is that we tend to approve by a regulatory process things that then society authorities don't really know how to manage. So by putting the two processes together, it's now a very clear signal of it has to have a manufacturing quality and it has to have a clinical minimum, but it has to have a return to society. And this EU HTA regulation is putting very plainly on the table what are those minimum requirements any new technology has to have. Of course, the capacity today of many member states is not up to speed. But again, because it's a law, they will have to get to that speed. And for some countries, they already say, well, this is not for me, this I already have a process. Okay, but if we want to construct a healthcare in Europe, then we have to agree on certain things. It is also true that the final word depends on national authorities. And I think that as for today, it is good because the budgets are not the same. And the legislation surrounding this legislation is not equal across all member states. So I think it's a very good step. It sends a very good signal to health technology developers. And it also sends a very good signal to countries knowing that they have to apply. So it's a convergence process.
So let's drill down to Spain in particular. What has been done in the Spanish healthcare system to benefit the most from the health technology assessment regulation?
Well, initially, Spain stood on a position of a bit lagging behind. Okay, they will tell me what to do. But on the other side, the Ministry of Health mainly just roughly one year ago prepared a new legislation package that would put the country up to speed to any legislation changes that would apply because of the EU HTA. So what has been done, the legal framework is there, so no one can say, I cannot apply it. And that's a very important signal. Then it is true, some of the things need to be enacted in the processes, the methods. And that's something that maybe we're still behind, but we would not anticipate a revolution, but rather a marginal and progressive change to something that is very much aligned with what other countries are doing at the European level, and which also allows for the entrance of other things, such as early dialogue, such as horizon scanning. And this is good because it's already in the law that is likely to be passed in the next coming weeks.
So if Spain were to get this right, what would health outcomes be for the residents here?
Well, I guess the immediate outcome is not having to deal with those difficult things, and probably aligning the process with the European standards. Spain, because it has had a different evolution, has like many other countries, has a unique process, but now there's a common denominator, and progressively, I think we will all go there. What are the immediate takeaways? Immediate takeaways are more focus on outcomes, more focus on comparators, more focus on patients, more focus on clinical societies' participation. So just by doing that, I think we're already better off.
Thank you so much for your time.
Thank you very much.
Here to continue the conversation is Pedro Falcon. As a national reimbursement authority in an EU country, where would you see the most impactful and beneficial aspects of the EU Health Technology Assessments Regulation?
As a payer, we want to be sure that we spend the money in the best way possible. And that means that we need to evaluate the value and the added value of new medicines with regard to the existing therapeutic standards. And that means it needs a lot of capacity, knowledge, expertise, methods, and techniques. And the HTA regulation will allow, on the one hand, that there's much more collaboration between HTA and payers all over Europe. And that means that we will be better able to evaluate in the best way possible the value and the added value of a new medicine. But more importantly, the processes of the HTA regulation, they will allow that questions we have as payers will come much more rapidly in the process through joint scientific consultations, through joint HTAs, and we will define the questions we have as payers already at the moment that the market authorization still has to be given. So that will help us and it will improve the evidence base for payers.
So what are some of the questions that you wish you could ask earlier in the development process?
Well, the most important thing is that we have the best data possible when it comes to value or added value. And that means that the firms, they need to know what the questions will be that a payer will have. It's about endpoints, it's about also the quality of the data we will receive, it's about the design of the research, and all these things. It's not good if that only comes at the moment when a payer is in discussion with the firm, when the firm is introducing a file for reimbursement. We need to give all these questions and all these requirements we have as payers much more rapidly in the process, and that will help.
So how do you assess value or value add?
Well, of course, we look at effectiveness of a solution, and we compare that with the existing standard of care. It can be a medicine or it can be another therapeutic intervention. And we have a series of classical methods to evaluate that and see if a new medicine comes with really added value. It's not enough that it's safe and that it's effective, but to pay for it, it also needs to add something to the existing therapeutic options.
Okay. Pedro, thank you so much for your insight. We appreciate your time. We're grateful to all of our experts for their valuable insight. I'm Aundrea Cline-Thomas for ISPOR TV.